Therapies for anxiety. Anxiety involves a general feeling of apprehension about possible future danger, and fear is an alarm reaction that occurs in response to immediate danger. When the anxiety crosses an unbearable mark, it leads to severe anxiety disorder. Treatments and therapies play a crucial role in reducing anxiety. Before we start the video, if you like our video, hit the like button and do not forget to share and subscribe to our channel for more informative videos on mental health awareness and learning. Coming back, treatment and therapies become extremely important when dealing with high levels of anxiety. There are several forms of specialized psychotherapy that have proved effective in the treatment of anxiety. Cognitive behavioral treatment. Cognitive behavioral therapy for anxiety disorders has become increasingly effective. It usually involves a combination of behavioral techniques such as training in applied muscle relaxation and cognitive restructuring techniques aimed at reducing distorted cognitions and information processing biases associated with anxiety disorders, as well as reducing catastrophizing about minor events. Cognitive restructuring involves identifying the cognitions leading to anxiety and challenging any inappropriate assumptions. Strategies may be rehearsed in the therapy session before being used in the situation in which the client feels anxious. Relaxation training involves a structured program of learning to physically relax and to slow and control breathing at times of anxiety. Worry exposure follows an exposure and response prevention approach. Cognitive methods. Cognitive methods for treating anxiety disorders focus on first helping patients to identify the thought patterns that are associated with their worries and anxieties, and then helping them to use cognitive restructuring and other methods to prevent these thought patterns from spiraling out of control. The methods can also decrease the intensity of patients' response to their thought patterns so that they are less likely to develop symptoms. Specific cognitive methods include the following: psychoeducation about the nature of anxiety and available treatment options and their possible advantages and disadvantages. Meditation, which helps patients learn to let go of thoughts and reduce the time spent thinking about worries. Self-monitoring, which helps patients become aware of cues that lead to anxiety and worry. For instance, patients may be asked to complete a daily log about their worries, identifying events or stimuli that lead them to worry more or worry less. Problem solving, which includes teaching the patients to think about worries in a very specific term rather than global ones so that they can be addressed through cognitive restructuring. These therapies also help the patient learn to identify and shift automatic, irrational thoughts related to all types of worries. We hope you like this video. For more videos on mental health awareness and learning, visit us at healthyminds.world and don't forget to subscribe to our channel by clicking on the icon below.